forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everyone. Today we are here again with an interesting topic with a respectful professor of our university, Dr. Ansarin. Hello Dr. Ansarin, I'm happy that you were here and we are really glad to host you here in this program. Can you introduce yourself to our audience?
Yes, thank you for your invitation. And I'm Dr. Khalil Ansarin. I am MD. Also, I have specialized in internal medicine, subspecialized in respiratory medicine, also in sleep medicine. I am in charge of the Division of Respiratory Critical Care Medicine and Sleep Medicine of Tabriz University of Medical Sciences. And I am in charge of the two research centers, Tuberculosis and Lung Disease Research Center, also the Rahat Breast and Sleep Research Center. We have a very big department which deals with the critical and non-critical respiratory problems, also with sleep medicine problems. So we have a large division which has two big pulmonary function labs, bronchoscopy units. Also, we have a big respiratory therapy unit, which is as a satellite for our critical care medicine, mainly also for pulmonary medicine. So we have a big capacity of the training respiratory therapy technicians in these units.
Great. And now we want to hear about the educational course that you have designed for any participant who will come to your course. Can you please introduce us the course and also even the title of your course?
Our course is actually two types of the respiratory therapy training courses. It's, one of them is a course designed for 6 months, which is a little detailed training in respiratory therapy. Also a mini course in respiratory therapy, which is the first one is designed for 6 months, and the second one is designed for only for 4 months, 4 weeks. So both of them are dealing with the, enabling the people to handle the respiratory therapy equipments in dealing with the variety of respiratory problems. The first one, with the six months course, is actually a detailed course handling the training in a little bit in physiology and pathophysiology of the respiratory system. Also, it details of the equipments which is being used invasively and also non-invasively in treatment of respiratory disease. Also, in some patients with sleep medicine, sleep diseases. The short one is the only is designed with a short course of introduction of the respiratory medicine to trainees, and also a short training in equipment which is being used in treatment of respiratory problems.
Okay, so I can say that the objectives are the same in both courses, but the first one that takes 6 months will be taught in detail, everything in more detail, and for the ones who maybe may have limited time, they can attend the 4-week course.
Yes.
And can I ask about the key concepts in this course?
The key concepts in this course is to enable the people to handle respiratory therapy equipments, and also in the introduction and application to the patients. Also, in the maintenance of especially the maintenance of these equipments, which is very critical in application of these instruments, because of the problems with the hygiene, also with the efficacy of the system and safety of the system. So it's needed to be, for the person, it's needed to be educated before starting to applying these instruments to the patients, because applying these instruments without previous knowledge and adequate education in the field may cause very significant harm for the patients. So in order to avoid these unwanted effects of the treatments, it is better to have the training at least for 4 months in this field before starting to apply it for the patients.
That's totally right, yeah. And I want to know about the team that you're working with in this course.
For the first type of the course, or that means 6 months course, we have 70 individuals trained in very different areas of the respiratory medicine, also technicians of respiratory therapy, which they are going to educate people in different aspects and disciplines of the respiratory therapy and also respiratory therapy equipments. For the mini course, which is for 1 month, we are going to have we have 20 individuals, which are designed in a fashion that they could provide enough training in 4 weeks for the trainees to be able to handle the instruments adequately and to be adequately capable to handle these instruments.
Great. So what you expect then from anyone who has participated in this course?
I think that first of all, I think I want them to be a little bit confident by themselves in handling these instruments, and also to be to have adequate knowledge of the instruments that they are using and the limitations of these instruments that they use, to be able to use it safely on the patients. Safety of the patient, which is the most important aspects of these medicine also, especially in this field that they are dealing with.
That's right, and I think it will be a useful course for the participants, and it is really necessary for anyone who works with this equipment to be trained. And is there any other thing you want to talk about?
I think that a lot of hospitals around, also maybe maybe the universities even, they are dealing with these issues without previous training of the technicians, which I think is a time to abandon this approach and to have the people with official training dealing with these critical issues, oxygenation and ventilation of the patients, which is the most important aspect of these, the application of these instruments, which is very critical. Everyone knows that the oxygen and the limitations of the oxygen supply to any organism, even the human beings. So it's very critical to have people with adequate training and to be sure that the people who are dealing with these instruments, they are adequately trained and they are capable of handling these instruments safely. The safety is the most important aspects of this kind of treatments, and in order to be confident that these instruments are being used safely, the best thing is to have the people to have good, effective, and reliable training.
Thank you very much. Thank you for your explanations. And I think, yeah, it's a really great program because you have designed in two ways, a full program and also a mini course that I think it's really a need and a must-do thing in these technicians. Thank you very much for accepting our invitation. It was really a pleasure for me to host you here. And thank you everyone for watching us. If you have any other question, you can reach out our support team via email, and also you can visit our website.
I have provided my link and also my email address and then the phone number, just in case that anybody interested, and they can contact me or through the Imam Reza as a website link. So
thank you very much.
They are available.
We will do that as the subtitle, the email address and also phone number of Professor Ansarin. Thank you very much.